Hello, everyone, and welcome to today's workshop. My name is Daheen Gustav, and I will be providing technical assistance during the workshop. Closed captioning and ASL interpreting are being provided. To view the interpreter, set your screen to gallery view. You can switch between gallery and speaker view in the upper right-hand corner of your screen. To view the captioning, click on the CC icon at the bottom of your screen and select Subtitles. All attending microphones have been muted to avoid background noise and webcams turned off to allow attendees to easily view the interpreters. During the Q&A session, please use the chat box to ask a question. Your question will be read out loud by the session moderator for the presenter to answer. This workshop is being recorded and the recording will be made available for future viewing. It is now my pleasure to turn it over to Dr. Amanda Ricard, Program Specialist at the National Institute on Disability, Independent Living, and Rehabilitation Research. Please go ahead.
Thank you. I'm actually Amanda Riekert from the National Institute of Disability, Independent Living, and Rehabilitation Research, or NIDLR. And Allison the director, will be talking to you, or deputy director will be talking to you in just a second. And I want to welcome you on behalf of NIDLR and the National Institute of Child Health and Human Development, or NICHD, to our workshop on disability and pregnancy. Thank you so much for joining us today. It's really exciting to me that so many people value the importance of the research and policy work related to reproductive health for women with disabilities. And I just briefly want to describe myself. I'm a white woman with blonde hair, shoulder-length hair, and I'm wearing a black shirt and a black sweater. And I have the ACL logo behind me. I'd like to also thank all of the players at NIDLR, NICHD, and New Additions who were instrumental in bringing this event to fruition. It really does take a village to make these things happen, and I'm so grateful for the input that everyone had. And I also want to let you know that we are all in for an amazing opportunity of discussion and learning on this topic today. And I'm so glad you could be here, and I think you will be too. And really, as you probably saw in the invitation, we really value your insights and invite you to join us in the conversation about this topic for the last portion of the session, which is the majority of the session. Please don't be shy about asking questions, speaking up, and putting forward your opinions and thoughts. That's the whole purpose of today. We want it to be really a conversation, not just a presentation. So now I will introduce Dr. Allison Cernich, the Deputy Director of the Eunice Kennedy Shriver NICHD. In her role, she assists the NICHD Director in overseeing the Institute's programs, supporting research on a wide range of topics, including, among other topics, reproductive biology, contraception, pregnancy, and medical rehabilitation. Thank you so much for joining us today, Dr. Cernich. We are looking forward to hearing what you have to say.
Well, thanks so much, Amanda. And I also want to add my good afternoon and welcome, and really so pleased that many of you could join us for the first of this 3-day workshop focused on disability and pregnancy. Just to describe myself, I am a white woman with about shoulder-length brown hair, and I'm wearing a gray sweater and a white shirt, and I'm in front of a blue background with some swirls on it and our Institute's logo and the Department of Health and Human Services logo. And before we begin, I'd also really like to thank NIDLR for their leadership in the area of reproductive health and disability. Both NICHD and NIDLR, as research organizations at HHS, focus on the health of individuals with disability. And I would argue reproductive health, including pregnancy, is really critical to the health of individuals overall. I also want to say thank you personally to Amanda and to the other NIDLR staff and contractors who organized this workshop, and the many folks who have agreed to join us over the next 3 days. To begin, it's really critical to understand that in the United States, 1 in 4 people experience a disability. And people with disabilities, we know, face many disparities in the health system. 1 in 3 people with disabilities report having an unmet medical need. And 1/3 of people with disabilities report not having a usual source of care. And these disparities in healthcare extend to reproductive healthcare. In this setting, and I'm certain I am not telling people anything they don't know, but it continues to surprise me how little we know about pregnancy and disability. Now, what we do know is, first and foremost, women with disabilities are just as likely to report wanting a child as women without disabilities. But we also know women with disabilities face disparities in pregnancy and birth outcomes. Women with disabilities are more likely to have comorbidities and be in worse health before conception. They are less likely to receive contraceptive counseling or to use contraception. And when they do become pregnant, women with disabilities are less likely to receive timely prenatal care. Women with disabilities have a greater risk for unintended pregnancies, perinatal complications, unjustified labor induction, and cesarean sections. And they are more likely to experience adverse pregnancy outcomes. Now, some of these barriers are driven by barriers to access to care. We know these outcomes are related to that. Many healthcare facilities do not have adequate physical accessibility for women with disabilities. So they can't access tables or scales, or sometimes even really access adequate birthing and labor and delivery supports. And this really impedes them from receiving routine reproductive health care. Also, information is not tailored for people with disabilities. So some of the educational materials that we have around pregnancy are not made accessible to people who have visual, hearing, or cognitive limitations. But I think even more than these barriers in access to care or education, and the more pernicious and difficult barrier to overcome is stigma. I once did an interview related to pregnancy and disability specific to individuals with spinal cord injury. And the reporter asked me, well, how do these people get pregnant? And I paused for a moment and said, pretty much the same way as everyone else. Do you need me to walk you through that? And I think that's really the overarching stigma, is that talking about sexual health in our culture and in our country is somewhat taboo, but also that there's this assumption that individuals with disability do not have sexual desires or needs, that they do not desire pregnancy, or worse, that they should not get pregnant because of their disability. Very few clinicians receive training on really identifying, understanding, and addressing the needs of women with disabilities, particularly around pregnancy. So I think the real opportunity in the next 3 days is that there are really powerful ways that research can help us to better understand pregnancy desires and healthcare needs for women with disabilities, and to better understand and address these drivers of disparities. For example, what are the relationships between comorbidities, access to care, and pregnancy outcomes and experiences among women with disabilities? Why are cesarean section delivery rates higher among women with disabilities than women without disabilities, even without medical justification? Why is there such a high rate of sterilization of women with disabilities? And what factors lie behind these disparities in prenatal care? And I'm really excited because I do think that research can help us to understand this, and more importantly, to incorporate the voices of women with disabilities in these conversations. Especially, I know my partners at NIDLR do such a great job in terms of this community involvement, and NIH is also turning more towards these community-based participatory research approaches. We've been working together as agencies to answer some of these questions, and I think there are many opportunities to address the gaps we've laid out. We have a new notice of special interest at NICHD on reproductive health, pregnancy, and parenting among women with disabilities. And we have a new concept coming forward, hopefully in an announcement, on promoting reproductive health for adolescents and adults with disabilities. Last week, we also had a roundtable focused on preventive reproductive health for individuals with disabilities during the transition from adolescence to adulthood. And what's going to be really exciting is over the next 3 days, we will hear from stakeholders, including women with disabilities, clinicians, and researchers about this important topic. The goal of this 3-day interactive workshop is really to identify priority areas of focus and create momentum for the research agenda we need to address inequities in pregnancy outcomes and related healthcare among women with disabilities, especially the inequities experienced by those who are also members of other underserved and underrepresented populations. So I want to thank you again for the collaborative work that we've been doing. I want to thank you for your voices ahead of time. I may not be able to be here for all 3 days, but I just want to say how excited I am to have this opportunity to hear the pressing needs so that we can continue to work together. So now I'd like to hand it back over to Dr. Amanda Rickard from NIDLR to introduce our first panel. Thanks again, Amanda.
Thank you, Allison. That was a very great highlight of all the issues and of many of the things that we hope to address today. And we sure appreciate your being here today, as well as our continued collaboration between NIDLR and NICHD. Now I'd like to introduce the panel members. And I'm deeply honored and humbled to introduce today's illustrious panel members. All of them are mothers, advocates, writers, educators, amazing human beings, and women with disabilities who have experienced pregnancy. We are most grateful for their willingness to share their expertise, especially related to their experiences with pregnancy and wherever relevant, the extent to which being a member of multiple marginalized groups affected their encounters and outcomes related to pregnancy. We also look forward to hearing them highlight what is most important to them related to research and policy in the area of disability and pregnancy. The format we will follow today is that the first panel member, Dr. Erin Andrews, will be the moderator. She is, among other things, the co-founder of the NIDLR-funded Disabled Parenting Project, a resource for support and information for parents and prospective parents with a wide range of disabilities. And in 2013, she testified in a congressional briefing about the lack of meaningful research data about parents with disabilities, the importance of equal access to reproductive health care and adoption, and the need for disability cultural competence among healthcare providers. And most recently, in 2019, she published a book entitled Disability as Diversity, Developing Cultural Competence. Next, I'd like to introduce Jennifer Senda. She is a mother to an 11-year-old son, a college student, an advocate, a speaker, and a blogger. I definitely encourage you to take a look at her blog and her other writing. The strength and poignancy are sure to impress, educate, and move you. And apropos to today's discussion, in 2017, she wrote, "I am a mother. I carried my child in my womb and I felt his movements. His heartbeat kept time with mine because he came from me. He is mine. I am his mother. I use a wheelchair, and yet that has never changed the fact that I am his mother." And last but not least, I'd like to introduce Heather Watkins. In addition to being a mother, she has served in many capacities related to disability and advocacy. These include being a member or chair of various boards, founder of the Harriet Tubman Collective, composed of Black, Deaf, and Black disabled activists and organizers, publishing, and blogging. I also encourage you to read her powerful writing as well, as a teaser for the magnitude of her work. And also relevant to today's discussion, I'd like to read a little paragraph she recently published on her website. "When our comprehensive stories are not circulated, shared, amplified, they don't get absorbed in the collective consciousness. Without absorption, there's little to no recall, and every rare expression becomes newsworthy and not normalized as an everyday fact. The danger in that is that such misconceptions of the disability community get harbored by larger society and persons who might run for office. This might then translate into harmful policy measures and our current dangerous dilemma where disabled persons sit positioned, yet gain at the mercy of lawmakers instead of enjoying peace of mind. The nerve of us for existing and wanting quality of life." Thank you all, panel members, for taking the time to be here and share your expertise and wisdom. We are eager to learn from you. And without further ado, I'll turn it over to Dr. Erin Andrews.
Thank you, Dr. Riekert, and thank you to everyone who worked to put today's panel together. As was mentioned, my name is Dr. Erin Andrews, and to give you a visual, I am a white woman with long blonde hair. I'm wearing an orange sweater and tortoiseshell glasses today. So I'm hoping that our panel can proceed a little bit like a discussion amongst three disabled mothers. I'm excited to be here alongside Heather and Jennifer today. The first question that I want to pose to the panel has to do with facilitators of healthy pregnancy. So in other words, what were the things that you can think of that helped you during your pregnancy to be successful and to be healthy? So either one of you can go first.
I'm sorry, I had to come off of mute. This is Heather. And just to give you a visual, I am a light complected Black disabled woman. I'm wearing glasses, my hair is pulled back. I have pearl stud earrings and a black t-shirt with a royal blue cardigan. And I'm sorry, repeat the question for me once more.
Sure. Oh, I'm sorry. I guess I jumped ahead too much. So Heather, maybe instead of answering the question, which I will repose to you, is would you give me a 5-minute summary of your pregnancy experience? I'll have you go and then Jennifer, and then I can do the same.
Sure, no problem. I was about 2021 when I became pregnant with my daughter. I was in college. I was followed through the high risk department of the OBGYN clinic. So they really couldn't tell me a whole lot about my specific disability, which is muscular dystrophy. I was born with a form of muscular dystrophy. It didn't impact, it does impact my mobility, but I didn't use mobility aids back then. And this was like in the early 90s. And I use mobility aids now, including a cane and a manual wheelchair on occasion. And I also use a ventilator to help me breathe at night because it now impacts my respiratory muscles. So yeah, you know, like I said, they couldn't tell me a whole lot about my disability nor disability in general. I was sent to genetic counseling and received plenty of blood work, screenings, and also ultrasounds, just to make sure that my daughter was developing, you know, on par with all of my other non-disabled peers. And so, yeah, it was pretty uneventful, so much and so far, but the lack of information and and support system that wasn't composed of other disabled persons was kind of where I was kind of left out and flailing. So to make a long story short, I was induced at 39 weeks due to having high blood pressure, and they were worried about me having eclampsia. My blood pressure was 165 over 110. Yeah, and so I was in labor for 26 hours. She was delivered on Thanksgiving Day. And she was delivered by forceps. And I had an episiotomy. She weighed 6 pounds and 15 ounces. And she had a little bit of scarring on her cheeks and also popped blood vessels in her eyes. And so, yeah, that was pretty much my story and my delivery. So it's pretty uneventful in terms of the duration of the pregnancy. But at the end, it got pretty scary because we didn't know, would I have to go through a C-section? Thankfully, we were able to just use forceps, which was scary enough because I had heard a lot of scary stories about, you know, she could become brain damaged. I had no idea. So luckily she was born with just that minimal scarring. Yeah. And she's in her 20s now. So
And she
yeah.
must have a birthday coming up then.
Pretty soon.
Thanksgiving.
Yes.
Wonderful. Thank you so much, Heather, for sharing that about your pregnancy experience. Jennifer, would you mind saying a few words about your pregnancy experience?
Sure. Hold on just 1 second so you can see me.
You take your time.
My name is Jennifer Senda, and I am a short Latina woman. I am a wheelchair user. I have dark brown hair, which is braided to the side, and I'm wearing a gray t-shirt, and I have red glasses on. My pregnancy experience was a little bit traumatic for me. In fact, it was so traumatic that I wasn't sure that I ever wanted to go through it again, just because I live in the Midwest and there wasn't a lot of information for me in my pregnancy. I was told when I was 16 that I would not be able to get pregnant. So when I got pregnant with my son, it was a big surprise. He was like, I'm here. It's, you know, and so I went and I got prenatal care. As I got bigger, it became more awkward. The hospital dropped me twice. I have cerebral palsy, so I don't have a lot of, I have a lot of hyper muscle tone, increased muscle tone. So that was very difficult for me. I was put on bed rest for most of my pregnancy, and I developed preeclampsia as soon as my water broke, my blood pressure shot up to 172 over 90. So it was bad. He was born at 5 pounds, 8 ounces. He was 21 inches long. And when I had I had a lot of stigma, and they were not going to let me take him home. They even snuck in some adoption papers in the paperwork. So they tried to get me to turn over my rights. Thankfully, I read everything before I sign it. And I had a lot of support from my family. So that was the gist of my experience. He was born via C-section, as I don't have a lot of mobility in my hips, and they didn't have a lot of equipment for me. Yeah, so it was an experience.
Wow, it sounds like an experience, and it sounds like for both of you ladies, it was kind of scary there at the end when you're giving birth and blood pressure spiking, and then Jennifer, gosh, it sounds just awful going through having being really pushed to put your son up for adoption when that sounds like that wasn't at all what you wanted.
No.
Well, like I was saying earlier, I am privileged enough to get to kind of straddle two worlds of academia and research, as well as my own personal experience as a disabled mom. So I've gotten to go through pregnancy as a disabled woman twice, and I am a triple amputee. And so I had my first child in 2011, and I was attempting a vaginal birth, and I was in labor with him for a very long time, but he was breech, and eventually we did have to have a C-section, and I was classified as a high-risk pregnancy in both instances, both with my son in 2011 and with my daughter in 2015, even though I don't think I was high risk for either of those, but because of my disability, I was sent to a perinatologist who specialized in high risk pregnancies. And the first time he said, "Why are you here?" I said, "I don't know. They sent me to you." He said, "Well, I'll tell you why you're here. You're here because OBGYNs are nervous about your disability and they don't know what to do with you." And I liked him right away because I thought that's some honesty right there. And in the end, I was glad to be followed by him because I got to have a lot more ultrasounds and things like that are, kind of fun when you're pregnant and you're eager to meet your baby. And so with my daughter, I also had a C-section. It was kind of, I felt like it was a foregone conclusion. I kind of wanted to try for a vaginal birth after cesarean, but I didn't get very much encouragement to do that. I was really encouraged, "Well, you've already had one C-section. You should just go ahead and have another." My second pregnancy was a lot harder for me. I was about 34 years old versus I was 29 during my first pregnancy. And so it was challenging. Another challenge that I had, and I can talk more about this later if we have time, but I also have a mental health disability. I have been on medication for clinical depression most of my adult life, and I had to change that medication during my pregnancies. And the medication that was selected because it was safer for my pregnancy, they were not as effective as the normal medications that I took. And like many women with mental health disabilities, I had a worsening of symptoms in the postpartum period with both of the births. So that's just a little bit about the two pregnancies that I had, and very fortunate that they were both successful, and my kiddos are about to be 7 and 10 in the next few months. So let's shift gears a little bit then. And Heather and Jennifer, I'd like to ask you, what kind of facilitators did you experience for a healthy pregnancy? And by facilitators, I mean, what were some of the things that were helpful that enabled you in terms of your pregnancy to be healthy or to have a successful outcome?
Hi, this is Heather. I think, having community-based support systems, like being able to get WIC, and nutritional supports, along with family supports in place, because I had a grandmother who had 10 children, who had given birth to 8 surviving children. So she was kind of the go-to person. She's a Black Southern grandmother, straight out of Greenwood, Mississippi, and came up in Jim Crow era South. And so she was the one we always went to for any questions regarding kids and babies and growth and development. And but along with that, you have some sort of cultural superstitions that come along with that too. What you shouldn't do, things that that might negatively impact you if you went along with that. If you stayed up too late, if you washed your hair during certain periods. So it was just interesting, to have all of this wisdom, to lean on. But yeah, a lot of community-based support systems, and just having family support and friends, but a lot of, again, going back to not having that community of other disabled parents to lean on was, I think, would have been critically important, just to kind of swap frustrations and get tips and resources and things like that. But yeah, those are the probably 2 biggest things for me that helped facilitate my pregnancy and well-being at that time.
Wonderful. Thank you so much, Heather. You mentioned community support as well as your family. And Jennifer, I think I heard you earlier talking about how you also had the support of your family. Would you say more about what facilitators for healthy pregnancy you experienced?
Okay, so I got access to appointments through, so I wouldn't have to transfer, because a lot of my family members don't have like a wheelchair accessible van, and those are expensive. So the insurance for me, I'm a Medicaid user. It helped me get to and from appointments, get to and from WIC, because as Heather mentioned, WIC is a great thing. I have a big Mexican family, so I totally get the whole, go to grandma for advice, go to your aunts for advice, go to your mom for advice. They really took me in and gave me a lot of information, some of which I used, some of which I didn't. It kind of, because I didn't know what would apply to me as a disabled woman, and I didn't have access to community at that time, to disabled parents as a community at that time, I should say. But I had a lot of support from family. They were surprised. My mother was surprised. She wept because she was told that I would never have children. So she was there. She was actively participating. I had help from my partner, who's been great throughout, our relationship, and throughout Edward's life. It was great. I had a lot of resources from insurance. My insurance was great.
Wonderful. So definitely hearing some themes in terms of family support and community resources. But also I'm hearing both of you say what was lacking too was the support from other disabled parents, and so it's difficult to apply information that's coming from the non-disabled community, even though they may be family or friends. You're not sure if that applies to what's going on with you and your body and your pregnancy. And I can definitely relate to that myself. I really was seeking out people with similar disabilities, even if I didn't know them very well or hadn't talked to them in a very long time. I really felt that urge to talk to them and pick their brains about what was it like, especially labor and delivery. And then also towards the end of pregnancy, it was so difficult to transfer. And a lot of the ADLs just became really difficult for me, like toileting and transferring from my wheelchair to my bed and things like that. So I was I was trying to find out, what did you do? How did you handle this? And those little nuggets that I was able to obtain were really, really valuable to me. So I would agree, you know, supportive family and the contacts I did have in the disability community were invaluable. So I want to shift gears again to the next question. And this question I'm going to be asking is, you know, what barriers or challenges did you face in terms of a healthy pregnancy? And in particular, were there any barriers or challenges that may have been related to being a member of another underrepresented or underserved community, as you're both women of color, and you may also have other identities that may have impacted your experiences. So I'm curious to hear what have been, what did you notice were the barriers or the challenges that you encountered?
This is Heather. I think even as I was nodding my head a lot when Allison was talking about the physical barriers, when you enter offices that aren't structurally accessible, you know, that don't have examination equipment that is accessible, the examination tables that aren't hydraulic, and you know, and you have difficulty getting on them to get a thorough exam. I have encountered that many times. In terms of cultural sensitivity and cultural competence, we can always use more of that, because you know, the information I was getting from my family and then the information that I might have been getting from my doctors in terms of race and culture didn't always coincide. My grandmother would say, no, you don't want to do that because, you know, this will end up happening. And that information is not really tailored for us as, you know, as Black women or as Black people, you know, so I found that there were some discrepancies. And so you know, and in terms of disability, there was a lack of that cultural competency and cultural sensitivity, which is always needed, because you need questions answered. You need a type of sensitivity when you're dealing with a range of disabled folks who have nuance, you know, and complexity, and you know, come in all different types of you know, lived experience and have different lenses. And so you're kind of just playing everything by ear. And that can be really scary if, you know, no one has answers for you and you have to look outside of medical settings and you know, in hospital settings who should be really welcoming, but really may not have the answers. So you kind of find yourself going about it in what feels like a vacuum, you know. And so I think those were some of the biggest barriers, just not knowing and not having a lot of providers who were, you know, knew a whole lot about disability or the range and how each, you know, person presenting with disabilities looks different and, you know, has you know, different lived experience, is what I'd say.
Absolutely. I totally agree with you there, Heather, with a lot of the different barriers and challenges faced by disabled women. What about you, Jennifer? Did you have any particular barriers or challenges that you encountered?
So I'm a first generation Mexican American. And when I was born, I have CP due to a medical malpractice, a medical mistake. That's the reason I have CP. My mother was 21 and she had just given birth to a 4-pound baby. And I was premature and there were no translators. So she had to depend on my 12-year-old uncle to interpret for her because there were no translators. So when I had my baby, I thought, okay, this is going to be cool. We're going to be okay. There were no, we're going to be okay. There's a lot of information. We're in the 21st century. Unfortunately, there is limited access. The rooms are very, very small. Medical professionals sometimes do not know how to transfer the disabled onto examination tables. I'm short, so I can't really put my legs into the stirrups, to be honest, to have a full-on exam. So they have to lift my legs. And then there's a lot of miseducation when it comes to CP, as far as what you can and can't do and what you can and can't understand. So I would get a lot of the speaking slow, like, do you understand what I am saying? Those kinds of, yes, I understand what you are saying, and I can probably speak it to you in 2 languages. I can repeat it back to you, like it was very frustrating because they did not want to communicate with me as a person. I didn't feel seen as a patient. That's a big thing, because you have to be respectful of every aspect of me, the Latina aspect of me, the disabled aspect of me, the woman part of me, because I'm not just a baby making machine. I am a woman with feelings. Please treat me with some respect.
It sounds like in a way they also really underestimated you, maybe underestimated your capabilities too.
Yes.
This is Heather. I just want to also say a lot of there is that patronizing aspect of maybe kind of like, do you know what you're doing? Will you have enough help? I remember after my daughter was born, the attending was saying, are you sure you can do this? And at first I thought maybe she's thinking, I look pretty young here. So maybe that's what she was talking about. Then it didn't dawn on me until later. She was talking about my disability. Are you sure you can do this? Are you sure you're going to be able to, provide for your daughter, physically care for her? I'm thinking, well, yeah, I can do this. I have my partner and my mother was in the room. But yeah, it didn't dawn on me till much later that that's what she was talking about. And you often get that kind of questioning. Are you sure? Like, people with disabilities we're not, fully actualized, and we don't think things through, or we don't have that competence to make these kinds of choices and decisions. So that was really frustrating.
Yeah, really good points. I mean, just in being underestimated and infantilized to a degree as well. Not trusted, not seen as capable of, making a decision and being able to care for the child. Absolutely. I think, as you both have been talking, I was thinking of a couple of instances that occurred during my pregnancies. In one instance, I was needing to use assistive reproductive technology, and in order to do so, I had to go through a psychological evaluation. And so I was sent to see a social worker who was supposed to do an evaluation of, I'm not actually sure, I guess, my fitness as a potential parent. And it was really illuminating, because when I got there, the social worker's office was on the second or third floor, and there was no elevator to get there. So I think that just illustrates, I mean, the point, right? Which is that, you know, for disabled women, so often there is no access. You know, and the other thing is, you know, when I finally did get the whole thing arranged, you know, there were a lot of questions that, you know, wouldn't really be asked of non-disabled women. You know, there was a lot of felt kind of interrogating about, well, you know, how are you going to get the baby out of the crib? You know, you only have, you know, one arm, like as if I hadn't been thinking about these things myself, and you know, planning and working on those things. So that stood out to me. Another thing that stood out to me was just how difficult it was to coordinate the care. I think in general, in our United States healthcare system, the onus often does fall to the patient to like pull everything together and coordinate our own care. And as people with disabilities, we get really well practiced at that, because oftentimes we are going from, you know, primary care to one specialist to the next. But one thing that was a really big deal in both of my pregnancies was anesthesiology, and trying to figure out what the correct dose was going to be for me because of my disability, because I have multiple amputations. And so I really had to do a lot of advocacy to get together the group of providers into a multidisciplinary team before the birth to start to talk about these issues. And I was able ultimately to get that to occur in both cases, but I think I was at a tremendous advantage because I am a healthcare provider myself, and I'm familiar with the systems. And so, you know, it made me think, you know, if it took this much for me to get this, you know, I know other women with disabilities are not getting the opportunity to have a multidisciplinary conference to talk about, okay, how are we going to approach the birth, and how are we going to coordinate and make sure that we're putting, you know, safety at the top of what we're doing here for both mom and for baby. So those are a couple things that, you know, I'm thinking of that were challenges or barriers for me. One thing I did want to circle back to, though, Jennifer, you mentioned earlier that you were dropped twice, and I just wanted to see if you wanted to say any more about what that was. And it sounds like it was a big challenge, or could have been, or was a major barrier.
All right. So the story of the situations where I was dropped. Okay, so I went to a routine appointment. Again, I was high risk too, just because of the disability. My mother didn't have preeclampsia or anything. There were no other things besides, you know, I have a physical disability. So the doctor, they had a 2-person transfer. They put me on the table, and the doctor was like, well, instead of calling somebody to assist her, she said, well, can you do this on your own? And I said, yeah, well, if you assist me, I can do this on my own. Well, she let me go before time, and I fell belly first straight to the floor. I smacked down to the floor, and I picked myself up as best I could. and I got myself into my chair, which is not easy because it's a manual chair, and I'm like 5 months pregnant at the time. I'm just like, I could not, I was in such shock. I could not believe what happened. So a couple days later, I went to the restroom and I told my cousin I had a lot of heavy bleeding. So my cousin took me to the hospital, and because it was a lot of bleeding, and they came to me and they said, well, were you having intercourse? And I said, no, I was not having intercourse. You dropped me. You guys dropped me. So they put me in the hospital for 5 days. And then in the interim of those 5, during the stay in the hospital, to monitor me and make sure everything was okay, they took me to the ultrasound room and they lifted me onto the ultrasound table. And I had, they did the ultrasound and they tried to do a two-person transfer again, and I was dropped again. So yeah, that was my experience.
Oh, that sounds awful. And it really drives home the point about the inaccessible environment and how incredibly dangerous that is. I think the other thing I was thinking about when you're mentioning that, and then Heather was talking about kind of the pressure, I remember like feeling like I had to prove myself. Like I had to get on that table and like show that I could do it, because I felt so scrutinized about like my capability as a mother. And and I think, again, like that could really lead to a dangerous situation, lack of training. And I think that's a big thing, right? As we're in these OBGYN settings, not necessarily rehab settings. So folks are not necessarily trained to help with transfers or that kind of thing. So thank you so much for sharing that with us. And we have about 7 minutes left in this portion. And so I'd like to just ask a final question, which is, what would you like for healthcare providers, researchers, or funders to know about disability in pregnancy? Heather, I think you may be speaking, but you're on mute.
Oh, sorry about that. Just that there's such a range, nuance, and complexity in terms of disability, and to just really familiarize yourself with the complexity, that disability presents and how it presents differently in different bodies. And that just to be mindful of the overlapping identities that of marginalized folks. I think it's also helpful to do research, outside research, in terms, social media is huge for disabled folks. Disability Twitter shares a lot of stories. I'm thinking of Alice Wong's Disability Visibility Project and the stories that she often shares. And she has a new book with 20 stories, little things like that, where disabled folks are often sharing their stories, but huge in across social media. Just to really get familiar with disabled persons out and about in the community, in projects like the National Research Center for Parents with Disabilities, where we are sharing so many of our stories, and there's workshops and webinars with different kinds of parents with disabilities, disability parenting projects that you are co-founder of. Great stuff. The blogs that so many parents with disabilities are talking about their experience is what I would tell a lot of clinicians and providers, but really to be and also to be structurally accessible, because it does us no good if we can't get into an office and feel like we actually belong or are welcome there. and then having those kinds of atmospheres and attitudes, like, we came across this decision, with a ton of information. And it's helpful to receive reproductive health care. That begins in school, where, young people can also start envisioning themselves as parents if that's what they choose. And also in media. I mean, let's face it, across the media landscape, where are disabled parents? I mean, that really helps with conceptualizing yourself as a parent and in the community, right? Because a lot of what we get is through media-based things. And those are really important in forming those ideas. So those are a lot of things that stick out in my mind in terms of what people can do to familiarize themselves with disability and disabled parents in general. But we also, I can say personally, in my experience, I was being a disabled parent and also a caregiver. So I was sort of sandwiched in between the two, and I was a caregiver for my dad for 11 years. So it's like one thing played against each other. I was able to get so much information and apply real-time advocacy skills to both of the roles, all while providing my own self-care. So yeah, it's a job, right? Yeah. So that's been my experience and also my advice.
Yeah, wonderful, wonderful points. And also just illustrates too, I mean, the different hats that we wear and the roles that we're all in, it's never just, we're never reduced to just one thing. And, getting to know your patients and what all they have going on in their lives, I think is incredibly powerful. Jennifer, do you have any final thoughts about what you would like for healthcare providers, researchers, or funders to know about disability and pregnancy?
I think that for me, it's important to for the whole entire stigma to be erased and rethought of, to understand that we are people and that we are capable of making our own decisions. And if we choose to be parents, we can be parents. If we choose not to be parents, we don't have to be parents, but it's all a matter of choice. And nobody has the right to take away your choice. And sometimes I would say, most of the time, the most important thing is for you as doctors or healthcare providers to listen to your patients, regardless of what you see on the outside or the kind of, because nobody fits into a box. So, take the box and break it. Shatter the box. We don't fit into boxes. Nobody in humanity does. So all we are asking is the respect and the honor to be treated as other human beings would be treated as anybody else. We just want the choice.
I love that you use that word choice, because in disability culture, unlike kind of traditional American culture, we don't value independence in the same way. We value autonomy, meaning we may not be able to do everything by ourselves. We may need assistance from others. We need maybe to use devices or medications or other tools, but what we care about is autonomy, being able to make our own choices about our lives and, have control over the way things go for us, even if we do depend on others. That's absolutely part of disability culture. Okay, well, thank you both so much. I think we can wrap up this portion and turn things back over to Dr. Riekert to facilitate the Q&A. Thank you all.
Great, thanks, Erin. And thanks for that. You guys really brought up a lot of powerful points and things to think about. And at this point, I want to remind the participants who are attending today that this is your chance to ask questions and participate in the conversation. And we really want you to participate in the conversation. and have it be a conversation. So if you have any questions for Erin or Heather or Jennifer at this time, that would be great. Otherwise, please just not just, so sorry, I'm getting messages. If you would ask your questions of either the panel members, or if you just have something to contribute about where we need to go with this research as we move forward, and at this time, what really we need to be focusing on, that would be great as well. So if you could send those questions to me in the chat, then I will be sure to voice them and we'll have someone respond. Someone says, oh, Monica says, thank you to NIBLR and NICHD for organizing this fantastic panel. I'd like to thank the panelists for sharing their stories. Tanya says, thank you all so much for sharing. Erin, could you say more about Disabled Parenting Project and its services, please?
Yes, I would love to. So the Disabled Parenting Project was created by Robin Powell, Kara Ayers, and myself. And basically, we were trying to meet a need that you've heard voiced already by the panelists, which is that oftentimes disabled people really need to hear from other disabled people. And that peer support is one of the most important means of helping people to be successful in pregnancy and in parenting and beyond. So the Disabled Parenting Project is we have a website, and I can put the link into the chat. And basically, we are kind of a clearinghouse for different resources for all things disabled parenting. We are associated with the National Center for Research on Parents with Disabilities through Brandeis University. And so there's also links to them as well, which is another wonderful resource. One thing that has been really successful, we have a website, we have different, blog posts, and, we have a whole directory of service providers that identify themselves as being open to providing culturally competent care or services to disabled parents. And we also have a community on our website. So, people can log in and post. But what we found is been the most successful has been our Facebook page, our Facebook group. So if you go to Facebook and look up Disabled Parenting Project, we have a presence there. And we also have a private Facebook group that is only open to parents with disabilities. And we have thousands of folks that are members of that group from all over the United States as well as internationally. And it's been a really great place for parents to be able to ask questions and get responses from other disabled parents who have been through similar situations. And this is something that wasn't available to many folks, even 10 years ago, and now it is. So we take a lot of pride in this work, and we welcome you to share the Disabled Parenting Project with any prospective parents or disabled folks who are already parents.
Thank you, Erin. We've gotten quite a few questions about healthcare providers and what everyone on the panel thinks it should be the focus and the approach of trying to help train healthcare providers so that they can treat women with disabilities without being patronizing or condescending, and just in general about disability etiquette and knowledge. Anyone have a comment on that?
I think that part of it is learning to see everyone, and I'm not just talking about people with disabilities, but especially people with disabilities for the sake of the panel and the topic today, to see people, as individuals with different needs, with choices, and to inform yourself and kind of submerge themselves into different cultures, because having a disability gives you a different perspective. So you have to be open and willing to see, as a healthcare provider, your patient's perspective. And to learn, empathy is a big thing. To empathize, not necessarily, we don't want pity, we just want a little empathy, and to be treated as you would treat anyone else.
I
Heather
think,
or Aaron?
yeah, I would just say, it would add to that. It's a balance. I mean, I'm a healthcare provider myself. And so I think it's a balance of, you really do need to, like Jennifer's saying, really listen to the patient, their own lived experiences and their preferences. And at the same time, be willing to do your homework also. So, you can't necessarily expect, a patient to come in and educate you from A to Z about their disability. I think you need to also be willing to do that research yourself. Check out what some of the latest literature is on that disability and pregnancy, or consult, reach out to your colleagues and consult about cases that are really unusual to your from your typical practice. So I think it's a little bit of both, making sure you're doing your homework and also allowing the patient to be the expert on her own experience and on her own body.
Excellent. Thank you so much. Anne says, how can we begin the change? What do you believe should be the primary focus? And while you're thinking about it, I just want to note that so many people are commenting how much they appreciate you sharing your experiences and your stories, and how grateful they are that you're here today.
So I don't know that I have the answer where should we start, but one thing that occurred to me that I didn't mention earlier was the experience of being referred to a geneticist. And I bring this up because I think that where we need to start very much is having to do with attitudes. And one thing that happened to me in my first pregnancy, when I was referred to a geneticist, which was actually not something that I asked for, but something that just kind of seemed to happen. And I went in and I said, I'm not planning on making any changes to my plan based on any type of genetic screenings. And the geneticist really, or I think in fairness, I think it was a genetic counselor, and the genetic counselor really was like, well, you don't understand how bad a lot of these disabilities really are. And I said, well, I'm not opposed to having information or anything like that. And so I wasn't opposed to, getting some of the testing done. But the whole underlying mentality is that disability is a bad thing. Disability is a medical failure. And, I didn't know, obviously, when I was pregnant, whether or not my children would be disabled, but the whole assumption was that I wouldn't want my children to be disabled. And, people, looking at me that, they wouldn't necessarily know if my disability is congenital or is it acquired or is it genetic or is it not. And, I think that that's really revealing about the whole kind of just the whole system, that we see disability as inherently negative and as inherently bad. And I think that our change has to begin there, right? So if I don't, view my disability as a tragedy, I don't think my healthcare providers should either. So I don't have the answer, but I do think that it really has got to begin with our own attitudes, our own beliefs. I mean, we all have biases as humans, as healthcare providers. Every one of us does. And I think it's important that we become really aware of what those are, because otherwise our actions are going to be congruent with those biases until we become aware of them and start to challenge them.
Anyone else want to comment on that?
Yes, this is Heather. Erin, that's a really good point. I just remember my provider at the time saying, oh, well, it's really early in the pregnancy, so, we have time. Meaning, if we do find out that your child is disabled, or, you can always terminate. I mean, that's fine if that's what you want to do, but just to have that be brought up so quickly and in that sort of this vein of, well, we're early, so we can, just, this can be a thing of the past. Didn't sit right with me. It's just, and I was just nodding my head when you were saying, on the idea of being pregnant or just wanting more knowledge about, your own reproductive health is just like, comes off as absurd, then we have a problem, when we don't present people with disabilities in this multifaceted way. That it's just disability itself is just synonymous with negativity, when in fact it's not. It has so much comprehensive aspects to it. And the world is not getting to see that, then that's a real problem. And so I think it's just it's a carryover into all of the other aspects of our lives. Disability permeates every aspect of our lived experience. So of course it would, be something that would affect our reproductive health and parenting. It certainly, affected my parenting skills. I mean, being disabled and having that lens and that lived experience, I had a higher sensitivity level, adaptive skills, analytical skills, logistical skills. And, those were, you can apply those to many different types of settings. And I feel like it enhanced my parenting skills because I became a more intentional and mindful parent. Because, as a disabled person, you're often sort of stuck in your own self-care because you have to be, but you're so much more focused on safety. So now that you have to do it for more than one person, I mean, that's some acquired skills there, right? You have to juggle all of that. And so, I definitely think I'm a much more in tune parent because disability was present in my life and is present in my life.
Thank you. Very good points and much to think about. And along those same lines, let me go back to Akara says, like Dr. Andrews, I'm also torn on this issue of high-risk pregnancy. Do panelists think we should focus efforts on the high-risk doctors, or should we discourage inaccurate labeling as a pregnancy as high risk if it's not?
Yeah, I think, I had mentioned earlier that, it's a tough call because, uh, again, my experience just one person's, but, so I went from my regular OBGYN office, where there wasn't, hydraulic tables, and was really inaccessible to when I got referred to the high risk specialist. It was a lot more accommodating. So of course I liked going there more because, they had the tables that were easier for me to transfer on. And like I said, I think that the perinatologist that I saw was also one individual, but was just really comfortable with my disability and just wasn't freaked out by it in the way that the other OBGYNs were. And so, I like that. And at the same time, like it was a overuse of resources that I didn't need. I mean, I didn't have any conditions that would have put me into a high risk category. And so, I mean, from a resource, allocation perspective, it was, not money that was particularly well spent. A lot of extra visits and things, and and so on. So I'm very, very torn, Dr. Ayers. I do think that mislabeling is a problem. I think, we know that, for example, the cesarean section rate is so much higher. I think we're seeing that a lot of that is probably going on unnecessarily, and that is dangerous, right? So I think that the mislabeling is a huge problem. I think that if we could accurately label folks and then provide accessible and culturally competent care across the board, that is the ideal situation, because women with disabilities, we are everywhere. We are in every city, we are in every community. And I think that every healthcare provider should be adequately prepared for us.
Thank you. Another question is, how can we make research on pregnancy for people with disabilities more inclusive and have it incorporate the voices of people with disabilities better?
Did you say how to incorporate more?
Yes, incorporate people with disabilities in research and making sure that the voices of people with disabilities are heard and incorporated into that work.
I think it has to start with better outreach services, like, again, using, looking on social media, but like community platforms, community forums, community centers, public health centers, your churches, even homeless shelters. How often do we, do outreach to disabled women in local shelters? So I think, incorporating different types of outreach methods to find more marginalized communities, especially. There are tons, like I come across so many people in social media groups, and I feel like I learn every day and all the time about, another segment of the disability community that whose experience doesn't mirror my own. So I'm always learning. It just never stops. I learned so much more about parents who are living with psychiatric disability. Even my own mother, my own mother has bipolar disorder. And so just to learn more about varying, different types of disabilities in different parts of the country, different parts of the world. I'm a part of international network of women with disabilities. So I love to learn about the infrastructure there in different countries where lack of infrastructure and what they do to sort of fill the gaps. It's always very interesting to me, and how they exchange information and how we all come together and talk about ways of building community. So just different methodologies like that, I think I personally find helpful, and I think researchers may find helpful too, is what I would suggest.
Excellent, thank you.
I think those are great suggestions, Heather, in terms of outreach. I think the other thing is to understand that when we look at the research on who even identifies as a person with a disability, studies indicate that between 7 and 18% of people who objectively have an impairment that what we would consider a disability do not identify themselves as a person with a disability. And that's a whole other kind of topic about the stigma related to even disability as an identity. But I think it drives home the point that I think we need to see a lot more cross disability research. So I see a lot of things that are very focused on one particular type of disability, physical disabilities or whatnot. And I think that, more cross disability research and more inclusive is better, especially because a lot of times people don't just fit into one category. They may actually have multiple disabilities. The other thing is involving disabled people in research, not only as participants or subjects, but as researchers. Have an advisory team, but that's not just to look good. An advisory team that's really going to inform what you're doing, and design your research so it's going to benefit the communities that are being studied, because that is what really motivates folks to get involved. And then finally, I would say it's very important to offer compensation, because women with disabilities, our time is valuable, and so often we're taken for granted in terms of our participation. And I think it's really important to compensate fairly people who do take the time and effort to contribute to research.
I agree, Erin. Thank you so much. There are a couple more questions. I know we're getting close to time here. David would like to know if there are any resources in particular that you would like to have had during your pregnancy, or that you think women now need in relation to their pregnancy that may not already be available or may not have been as good as you would have liked.
I think that maybe access to other mothers with disabilities, like support groups, not just online, but to gather up together and to speak and to kind of find that support within each other. Because as a disabled mother, my pregnancy was rather lonely, in the sense that nobody really understood what I was going through. It's sort of a kind of, everybody has advice about pregnancy, but nobody can see it from my perspective except for other mothers with disabilities. And, because pregnancy is so different for any woman in general. But if I had somebody that, understood at least a little bit of my perspective, it would have been a little bit less lonely. Maybe support as far as checking on the mental health of said mothers with disabilities, because a lot of conditions are comorbid. Maybe opening up to hearing more than an evaluation or a survey, listening to what your patient is feeling. I don't know, in terms of their mental state at the time, their fears, their what they feel secure about in their pregnancy, in their parenthood, those different aspects of it.
This is Heather. I love all of Jennifer's suggestions. I also often think about things like, Lamaze class for disabled parents. I hadn't come across that. I see more massage therapists now for disabled people. And I think that would be great to have those kinds of services for, pregnant mothers, pregnant people looking for that kind of support too. Because it's often not just the exercise, it's that convening with other prospective parents or disabled parents that Jennifer was talking about, that is very helpful. And that could be, another forum for people to exchange information and get resources and tips. Because, we don't live these single issue, single lens lives. It's very multifaceted and complex, and, again, has that range and nuance that we're looking for. And I think more of that would be very helpful to parents and prospective parents.
I think you bring up a really great point, Heather, and some of the questions have been in that vein of looking at some of what we would typically consider more ancillary services and but are critically important, like you're saying, labor and delivery classes. Someone mentioned postpartum care and lactation consulting, and have those things, those classes and providers been educated in how to address anything that might be unique to a person with a disability. And so that's something else for us to think about, not just consider OBGYNs, but the whole range of providers. And one person also asked about doulas and what your thoughts are on how supportive you think that would be, and would that make a difference in the quality of your labor and delivery and pregnancy?
I think that there's a movement right now to be more inclusive of a wide range of traditional and non-traditional approaches to pregnancy and childbirth, including doulas. And I think women with disabilities should have the same choices and same opportunities as those without. But traditionally, our pregnancies have been so medicalized. I mean, this is where you really see that medical model focus, and the increase in cesarean sections and the longer hospital stays. And so I think again, any type of approach that is going to increase choices and take a more holistic approach to health and wellness could potentially benefit the disability community as well.
Erin, that's a good point too, because I was thinking about when I was, after I had my daughter, so I was in there from Wednesday to Sunday. So we do have longer hospital stays, but also follow-up care. So if it takes us longer to sort of acclimate ourselves and any new parent, obviously it takes a moment, but for a disabled parent, it's more compounded, and so I think the follow-up care that needs to be incorporated in it as well, including home visits, because I think those are critically important to have someone drop by and say, well, what kinds of things would be helpful for you, including, nutritional care, because we're also tired, but again, a disabled mom and disabled person's doubly tired, housework, and to just the postpartum can be really, really complex and intense for that disabled parent.
Well, I see that we are past our time. I want to thank all the panelists again today. This was fantastic. And there's so many comments about how much people have learned, what they're going to take back to their lives, their offices, their professions, about what they learned today. And that's just really powerful. I hope that everybody can join us for the next 2 days also. Some of the questions that we didn't have a chance to ask will likely be answered in those next 2 days. So you'll want to join us for that. And I want to thank everyone again for attending today. And we'll do our best to answer some of the other questions over time as well. So thanks again, and I'll look forward to seeing you guys hopefully tomorrow. And I think the contractor has one more thing to close us out.
Yes, thank you, Amanda. And thank you all for attending day 1 of the Accessibility of Motherhood, a workshop on disability and pregnancy. The topic for tomorrow's workshop is disability and pregnancy, healthcare providers. And this concludes today's event. You may now log off at any time.